Packaging of Pharmaceuticals Part First, presented by Mr. Sandeep Dattatreya Kardile, M.Pharm Pharmaceutics, Lecturer, Mula Rural Institute of Pharmacy, Sonai. Contents of presentation: Introduction to packaging, functions of packaging, types of packaging, package testing, types of packaging materials. Introduction: Packaging is the science, art, and technology of enclosing or protecting products for distribution, storage, sale, and use. Packaging also refers to the process of design, evaluation, and production of packages. Pharmaceutical packaging can be defined as the economical means of providing presentation, protection, identification, information, convenience, compliance, integrity, and stability of the product. Some important definitions. Firstly, container. It is a device that holds the drug or dosage form which may or may not be in a contact with drug and used for storage. Then closure. It is a device which is used for opening and closing of container. Functions of packaging. First, product identification. Packaging greatly helps in identification of product. Then product protection. Packaging protects the contents of a product from spoilage, breakage, leakage, etc. Third, facilitating the use of product. Packaging should be convenient to open, handle, and use for the consumers. Product promotion. Packaging is also used for promotional and attracting the attention of the people while purchasing. Types of packaging. Primary packaging is the material that first envelopes the product and hold it. This usually is the smallest unit of distribution or use. For example, aerosol spray can then blister packs bottle. In diagram, this primary packaging it is shown. Secondary packaging. It is outside the primary packing, perhaps used to group primary package together, for example boxes and cartons. In the diagram, it is shown secondary packaging, boxes and cartons. The tertiary packaging. It is used to bulk handling and shipping, for example barrel, container, edge protector. So these boxes they are the example of tertiary packaging: barrel, container, and edge protector. Then package testing. So these tests are used: first drop test, then vibration test, then shock test, inclined impact test, then revolving drum test. Then types of packing materials: glass, plastics, rubbers, paper or cardboards, and metals. The choice of packing material will depend upon: first, the degree of protection required, compatibility with the dosage form, third, customer convenience, for example size, weight of dosage form, then filling method, and sterilization method to be employed, and cost. Glass. Glass has been widely used as a drug packing material. Advantages: they are transparent, they have good protection power, they can be easily labeled, then they should be economical, then they are available in various variety of sizes and shapes. Disadvantages: glass is a fragile, so easily it can be broken. It can release alkali to aqueous preparation. Then composition of glass. It contains sand, that is silicon dioxide, soda ash, that is sodium carbonate, limestone, calcium carbonate, cullet, that is broken glass, aluminium, boron, potassium, magnesium, zinc and barium. Then amber, light yellowish to deep reddish brown, carbon and sulfur or iron and manganese dioxide. Then yellow, compounds of cadmium and sulfur. Blue, various shades of blue, cobalt oxide or occasionally copper, that is cupric oxide. In green, iron oxide, manganese dioxide and chromium dioxide. Manufacture of glass. The four basic processes used in the production of glass are: first, blowing. It uses compressed air form the molten glass in the cavity of metal mold. In drawing, molten glass is pulled through dies or rollers that shape the soft glass. In pressing, mechanical force is used to press the molten glass against the side of a mold. In casting, uses gravity or centrifugal force to cause molten glass to form in the cavity of mold. The types of glass: type 1, that is highly resistant borosilicate glass; type 2, treated soda lime glass; type 3, soda lime glass NP, soda glass non-parenteral usage. Type 1, that is borosilicate glass. It is highly resistant glass. It has high melting point, so can withstand high temperature. It is more chemically inert than the soda lime glass. It can resist strong acids, alkalis and all types of solvents. Uses: laboratory glass apparatus, then for injection and water for injection. Type 2, treated soda lime glass. Type 2 containers are made of commercial soda lime glass that has been dealkalized or treated to remove surface alkali. The dealkalizing process is known as sulfur treatment. Sulfur treatment neutralizes the alkaline oxides on the surface, rendering the glass more chemically resistant. Uses: used for alkali sensitive products, infusion fluids, blood and plasma, large volume container. Then plastic. Plastic may be defined as any group of a substance of natural or synthetic origins consisting chiefly of polymers of high molecular weight that can be molded into a shape or form by heat and pressure. Advantages: less weight than glass, flexible, variety of sizes and shape. Disadvantages: absorption, permeable to moisture, then poor printing, thermostatic charge. Then types of plastic: thermosetting type. When heated, they may become flexible, but they do not become liquid. For example, urea formaldehyde UF, phenol formaldehyde, melamine formaldehyde MF, epoxy resins epoxides, polyurethanes PURS. Thermoplastic type. On heating, they are softened to viscous fluid which harden again on cooling. For example, polyethylene, HDP, LDP, polyvinyl chloride PVC, polystyrene, polypropylene, nylon PA, polyethylene terephthalate PET, polyvinylidene chloride PVDC, polycarbonate, acrylonitrile butadiene, styrene ABS. And metals. Metals are used for construction of containers. The metals commonly used for this purpose are aluminium, tin plated steel, stainless steel, tin and lead. Advantages: They are impermeable to light, moisture, and gases. They are made into rigid unbreakable containers by impact extrusion. Then they are light in weight compared to glass containers. Labels can be printed directly on their surface. Then collapsible tubes, metal. Disadvantages: the collapsible metal tube is an attractive container that permits controlled amounts to be dispensed easily with good reclosure and adequate protection of product. It is light in weight and unbreakable and lends itself to high-speed automatic filling operations. Most commonly used are tin, aluminum, and lead. Metals: tin. Tin containers are preferred for food, pharmaceuticals, and any product for which purity is considered. Tin is most chemically inert of all collapsible metal tubes. Aluminum. Aluminum tubes offer significant savings in product shipping cost because of their lightweight. They are attractive in nature. Lead. Lead has the lowest cost of all tube metals and is widely used for non-food products such as adhesives, inks, paints, and lubricants. Lead should never be used alone for anything taken internally because of the risk lead poison. With internal linings, lead tubes are used for products such as chloride toothpaste. Rubber. Rubber is used mainly for the construction of closure meant for vials, transfusion fluid bottles, dropping bottles, and as washers in many other types of products. Butyl rubber advantages: permeability to water vapor, water absorption is very low. Disadvantages: slow decomposition takes place above 130 degrees Celsius. Oil and solvent resistance is not very good. Silicon rubber advantages: heat resistance, extremely low absorption and permeability of water, excellent aging characteristic. Disadvantages: they are expensive. Lastly, thank you.